So I'm going to talk through the ultrasound guided acromioclavicular joint injection. The skeletal anatomy is very important. It's a joint between the lateral end of the clavicle and the acromion process of the scapula. And the way to perform this injection under ultrasound guidance is holding the probe, feeling for the lateral end of the clavicle and this scapular acromion process, and ultrasound probe will be positioned this way. The injection technique to perform is out of plane, or you could put lots of gel and perform a gel standoff technique, bringing the needle in plane, getting into the joint cavity. The other structures to be mindful of, you will be able to see supraspinatus muscle sitting just below the joint, and on the top of the supraspinatus muscle, you will also have subacromial subdeltoid bursa visible. So injection, whilst performing the injection, the clinical pearls are use a superficial, it's a superficial injection, so you only need to use 25 gauge needle. About 50 millimeter needle will be very good enough, and you will be able to get into the joint out of plane or in plane, bringing the needle and slipping into the joint. The volume of the local anesthetic is about 2 mLs of lignocaine and steroid mixture. So we're going to talk about the ultrasound guided acromioclavicular joint injection. The patient position will be sitting position with the arm supine. This is a neutral position where majority of the shoulder scanning gets done. Next step would be to feel for the clavicle lateral end and the acromion process, and feeling for the joint between the lateral end of the clavicle and the acromion, which will take you to the acromioclavicular joint. As you could see it in the image, we have an acromioclavicular joint in the middle of the ultrasound image, and here we'll show the structures. This is the lateral end of the clavicle. This is the acromion process. This is the superior part of the acromioclavicular joint capsule. Deep here is the supraspinatus muscle. To perform this injection, you can perform the injection in plane from lateral to medial using a gel standoff technique, or you can perform the injection out of plane in the middle of the probe, putting the needle, entering in. 25 gauge needle should be enough to access this joint. So out of plane or in plane, the joint volume is very small, so 1 to 1.5 cc of local anesthetic and steroid mixture should be suffice this block.